Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. The Ministry of Health's official guidance on its COVID-19 website had initially listed a few groups it deemed are not suitable to receive the Pfizer-BioNTech vaccine. Now, these groups include women who are pregnant or planning to get pregnant, cancer patients who are undergoing active treatment like chemotherapy, radiotherapy, or immunotherapy, as well as persons living with HIV with CD4 counts of less than 200. Now, tonight on the show, we're going to be asking the experts what the science says about excluding these groups from mRNA COVID-19 vaccinations. So tonight, we've got our first guest on the line, Professor Dr. Ling. She's a consultant gynecological oncologist at University Malaya Medical Center. She's also the program designer of Program ROSE, which stands for Removing Obstacles to Cervical Screening. Ling, good evening. Thank you so much for joining us on the show tonight. Now, I'd like to begin our conversation with cancer patients undergoing active treatment. Now, we have these MOH guidelines, but if we look at international recommendations, you've got the CDC in the US, Center for Disease Control. You've got the National Comprehensive Cancer Network in the US also saying that actually cancer patients are a high priority group. They need to, they are at high risk of getting severe complications from COVID-19. How should we be thinking about this, Ling?
Okay, thank you for having me on, Melissa. I think let's take a step back. In terms of the word cancer patients, that's actually a very broad term. You have patients of different stages of cancer, of different age groups, and I think that needs to be considered carefully. Patients make decisions every day, whether to have chemo or not, what to eat, whether I go into hospital. So this is just going to add on the decisions that they have to make. And the second thing we have to consider, what is considered active treatment? Now, when we treat cancer, we have a whole armamentarium of treatment options. We have surgery, we have radiotherapy, we have chemotherapy, we have these new immunobiologics, we have lymphocyte depleters, and these have to be considered very carefully. So let's take a step back. Most guidelines, if you look at the guidelines, there's a broad statement that says cancer patients on active treatment should not receive the vaccine. Now, when we look at these statements more carefully, even in our national strategic program that was launched 2 days ago, it says that the COVID vaccine is safe for the majority of people. However, some groups will need further consideration. And that statement, further consideration, is quite important. So it's not a blanket statement for all. And it also states that information will be reviewed periodically. So,
Ling, so considering,
sorry
to interrupt you, but having laid that out for us, who should be making this decision? Is it the patient in consultation with their specific doctor? Should it be government? How do you envisage it working effectively?
Okay, I think the government has laid out a guidelines, and to be honest, the program will be elicited in a phased manner, and so patients will have to put in their data into the MySejahtera app. For example, if you look at the app, it states what type of comorbids you would have, and cancer is one of them. And our minister and our DG has stated in his press conference recently that cancer patients will be considered high risk and will be vaccinated in the phase 2 of our program. In terms of who should get it and who is at risk and who will benefit from it, that discussion has to take place between the patient and the healthcare professional. And that comes the element of perceived risk and benefit. As a doctor who treats cancer patients, there are guidelines. The guidelines are there of who to have chemotherapy. But when it comes to a one-to-one, an individual basis, that discussion needs to be had with the patient, because it's important to see what risks or what side effects the patient is prepared to have themselves. So, for example, if the patient has had a relative who's gone through, has been hospitalized for COVID, they would perceive the risk of COVID to be very different from the risk of cancer. And that conversation needs to be held. But there are certain basic rules that need to be, or information that needs to be conveyed. These vaccines, or at least the Pfizer-BioNTech vaccine, is not a live vaccine. It does not cause the patient to have COVID. It will reduce the risk. And the information that we have at hand so far is that it is a safe vaccine. We hear a lot of statements saying that if you're immune compromised, what happens? Why the science behind it is that we aren't too sure if the patient's total white cells and lymphocytes are low, whether they're able to mount or whether they can build the antibodies to protect them. It's not that they will be harmed. It's whether they can mount and respond to those vaccines effectively.
Okay. All right. Ling, I want to jump in here and ask you about, you mentioned a little bit earlier that the guidelines from the Ministry of Health will be reviewed periodically. I think that's great that, there's a certain flexibility and an element of us still learning about this disease and the pandemic. But I'm wondering what that means for communication, what that means for confusion. Again, you've got guidelines that's gone around and people talking about it, asking, well, should I? Do I qualify for a vaccine? Should I not get the vaccine? So there's an element of confusion there. How do we think about that? What role do medical practitioners like yourself play in, bridging that communication gap?
I think always look at the science and evidence. I think as healthcare professionals, it is our duty to ensure that we are updated constantly. For example, the Joint Committee for Vaccination and Immunization in the UK, their guidelines changed 3 times over the last 3 months. In November, there's a December 3 version, there's a December 30th version. And I think it's very important for us to keep updating ourselves. We now have more than 140 million doses of vaccine that has been administered. And these numbers will continue to go up, and we continue to monitor the side effects. And we will build a repository of data of whether patients will be protected or whether there are side effects that can only be seen when we see large numbers vaccinated. However, we must be reassured that these are not new vaccines. These vaccines, or the modality of these vaccines, have been around for many, many years. And therefore, we have a basis, a biological basis of understanding of whether these vaccines are safe. In terms of cancer patients, I feel very strongly that we should not deny cancer patients under the blanket rule that they should not get, or there's dangers or there are side effects associated with the vaccine. And their doctors should be able to address this based on the scientific evidence that's available.
Ling, one of the given conditions of this vaccination program is that the interface for most people will be through the MySejahtera app. The question is whether the app is an adequate interface for the complexities of an individual's status with regard to whether they should or should not take a vaccine. And I wonder if you have looked at that and whether your patients are also concerned that they might either foreclose the possibility of a vaccination if they get the answer wrong on the MySejahtera app.
Yeah. I personally used the app yesterday, and it was quite nerve-wracking because I want to make sure I get the right information in. And I think the take-home message is that, yes, there will be some element of anxiety when you put in the data, but they're quite straightforward. And once the data goes in, I think that the priority will be looked at carefully. And when you're called, so you just pick it as cancer, but even as you're called, I think there's an opportunity. You see, even when you're called for your appointment, if you look at the program, there are different stations in which the individual gets to confirm their registration, ask questions, have their blood pressure checked, they're vaccinated, and they're observed. So I think it's not a once you commit, there's no turning back type situation.
Right. Can I very quickly ask you, how do we think about this group? So I think one of the groups that was also mentioned that's been discouraged from getting vaccinated against COVID-19 was pregnant breastfeeding women or women who were planning to get pregnant. Do we think about them the same way as how you've just laid it out for us, the way we should be thinking about cancer patients, which they're not all homogenous?
I think you look at most guidelines, and that's because pregnant patients are always disadvantaged in terms of their getting therapy. For example, if you look at many of the antibiotics that we give pregnant patients, if you look at the leaflet that's inserted into the package, it says do not or consider very carefully before you give it to a pregnant patient because there's no safety data. This is the same principle for the vaccine among the pregnant women. So when the trials were carried out, there were no pregnant women that were included in these trials. Having said that, some patients who were not pregnant when they entered the trials subsequently became pregnant, and they did not have any increased side effects. The flip side of this, the data now is quite strong that if you're pregnant and you get COVID, the symptoms are worse, the outcome are worse. So this risk-benefit needs to be discussed with a healthcare professional. In the UK, where they've started the vaccination program, I've had discussions with my colleagues there before, and the group of pregnant women that come forward to have this discussion of availing themselves to the vaccine are healthcare professionals. Very often, the healthcare professionals themselves are living in a household, the nurse and the doctor and their children. They're all in the same household, and they're at increased risk of getting COVID. So under those circumstances, I think the risk-benefit needs to be considered, and they do avail themselves of the vaccine. It's not that it's a complete contraindication. They can have it if they understand the risk and the lack of data associated with vaccines and pregnancy. Similarly to breastfeeding as well.
Right. Just very quickly, one last question, and this has to do with the question, the issue of choice over the kind of vaccine we get. We know that in Malaysia we're going to be getting a whole range with very different types of technologies, inactivated viruses, maybe with the Sinovac vaccine, for instance, quite different from the mRNA that we have been talking about. So in a situation like that, how does the patient negotiate choice over vaccine, whether or not to have it, what vaccine to have, and so on and so forth? How does that work out?
Okay, so I would really like to persuade people to trust the processes in which ask me, would you have this, would you have that? I tell them I would have whatever that's given to me because I trust the data. I've looked at the data of the vaccines that are being brought in the initial phases have shown good evidence that they work in a population basis. So I think let's not complicate the matter by adding our own evaluation. The vaccines that we have our government and our NPRA has done the due processes to bring in safe and effective vaccines and to ensure that there's a smooth and effective program for our country so that most of us are vaccinated. I think it's good, and let's go along with it and cooperate to have whichever vaccine that we are offered. The vaccines are very good. It is in our immunization program booklet. The efficacy, the side effects, what type of vaccines, it's all there.
Right. Ling, thank you so much for joining us on the show and bringing some much needed clarity to the subject. We appreciate your time. We're going to take a quick break here on Consider This, but after this we'll come back and speak to an expert in HIV medicine. So stay tuned to Consider This.
Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. AWANI 7.45 lebih awal dari biasa.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah. Podcast dikemas kini dengan berita dan program.
Rebirth, reformasi, resistance and hope.
Serta video tanpa had dengan scroll tanpa henti. Buat turun aplikasi baru Astro AWANI sekarang.
Gagalan Kerajaan Persekutuan tunai janji melaksanakan projek baik pulih sekolah daif turut diulas Menteri Muda Pendidikan dan Penyelidikan Teknologi Dr. Anwar Rapai.
COVID-19, 2 lagi kes disyaki atau PUI direkodkan di Sarawak.
So hopefully kita akan mendapat kedudukan yang lebih baik di masa-masa akan datang.
Udang geragau atau bubuk dalam bahasa tempatan terkenal sebagai bahan utama dalam pembuatan belacan atau cencaluk.
Amanah di tangan kita. Adat, budaya dan semangat menjadi kesinambungan perpaduan tanah air yang tercinta. Berteraskan adab yang terpahat di jiwa dan raga. Marilah bersama kita membina negara Malaysia. Bila sentuh soal berita, tiada masa untuk tunggu. Kepada anda kami bawakan fakta, susulan dan kupasan yang terkini. Tiada drama dan tiada pengulangan. Usah tunggu lama-lama. AWANI 7.45 lebih awal dari biasa.
Kini berwajah baru.
Ini pula susulan khas pesawat Back Air di Kazakhstan. Pesawat berkenaan dilaporkan tergelincir 2 kali.
Notifikasi berita terkini dan navigasi mudah.
Hi, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. The Ministry of Health's official guidance on its COVID-19 website had listed persons living with HIV with CD4 counts of below 200, CD4 being the protein found on immune cells, listed that group as one of the groups that's not suitable to receive the Pfizer-BioNTech mRNA vaccine. Now, this, however, seems to contradict international advice. So, Dr. Khairil Erwan Khalid joins us on the show tonight. He's the Secretary of the Malaysian Society for HIV Medicine. Khairil, thank you so much for joining us on the show. Now, the first question off the top of my head has to be the one that's on the forefront of people's minds reading this guideline. Should people living with HIV/AIDS be given the COVID-19 vaccine?
All right. Thank you, Melisa, for having me tonight. So on behalf of the Malaysian Society for HIV Medicine, or in short, MASHM, we actually made consensus and also recommendation that people living with HIV should be offered the COVID-19 vaccination. This is because, at the current moment with the limited data, the impact of COVID-19 on people living with HIV or PL-HIV is rather unclear. But of course, with recent evidence, we know that there's a cohort of PL-HIV in the UK that they tend to have a poorer COVID-related outcome. But as a general rule, we do believe that PL-HIV may face similar risk in contracting COVID-19 disease as compared to the general population. So, in line with the international guidelines and recommendations, we should be prioritizing and offer COVID-19 vaccination to PL-HIV.
Khairil, can you explain to us why you think then that the government is advising people people living with HIV not to have the vaccine?
All right. Because, generally, one of the I would say, contraindication or people who not advised to have the COVID-19 vaccination is when someone has got immunocompromised diseases, so things like malignancy, autoimmune diseases, and that includes HIV as well. But we do know that the vaccines which are available in the market, they are not live virus vaccines, so they should be safe for people with, immunodeficiency diseases that include HIV. So they are. It is not an absolute contraindication. People living with HIV should be offered the vaccine.
Okay, and I like that you said should be offered the vaccine and not, as a blanket as a blanket rule excluded as a group. I'm wondering though, I mean, do people living with HIV have that option? I mean, if they wanted to take the vaccine, could they, regardless of the guidelines? I'm wondering because, as we know, we have to register for the vaccine and declare our comorbidities. Is HIV one of the things that you have to declare?
So as you know that in the National Immunization Program, it has got 3 phases of rolling out this vaccine. So the first phase is basically for the frontliners, and the second phase is for elderly, more than 65 years old or with comorbidities, right, and chronic illness. And then phase 3 for all the other adults above the age of 18. So I guess if you do have HIV and you fall into those categories, that if the time comes when the respective phase has come and you are entitled to have the vaccination, then I think we should take the vaccination then.
Khairil, can we make a distinction between people living with the virus, people who are HIV positive, and people for whom that virus has expressed itself in disease, so people living with AIDS? Is there a distinction to be made between these two groups, the 2 stages, perhaps in the life cycle of the disease for an individual? So you're talking about basically someone who's got HIV and on effective antiretroviral treatment, as opposed to someone who's treatment naive or not poorly controlled disease despite being on treatment, right? Of those 2 spectrums, well, in the trials, it looks like there are patients, there are PL-HIV who are well controlled on antiretrovirals. They are some of the trials that included these people, and actually, in terms of the safety signals, are similar with those who do not have HIV. But again, as I said, these vaccines are not live virus vaccines. So, irrespective of their immune level system as the measurement of the CD4 count or their viral load, whether they're suppressed or not, it should be protective for the PL-HIV to get this vaccine.
Right. If I want to kind of widen the conversation, can I ask you about whether, how the challenges has been in this past year of the pandemic has been for persons living with HIV in terms of access to medicine and healthcare? Has that, has there been challenges and obstacles because of the pandemic?
Yeah, definitely. I think it's more because of, those patients who are on antiretroviral treatment, sometimes it can be quite difficult for them to, come in and out to the hospital to get their treatment because of the limited visiting hours, or even sometimes we sort of reduce the number of patients who come in the clinic and so on. So and sometimes of the restriction of traveling because of the MCOs and stuff. So sometimes we do have patients who have difficulty to come to see the doctor for their appointments and to get treatment. But of course, we have ways on how we can try to accommodate to these patients in terms of, those stable patients who are on treatment, they are doing very well with very good CD4 and virologically suppressed. We can sort of do like a virtual clinic with them, and make sure that if we can actually prescribe them longer duration of medication so that they don't have to come regularly to the clinic or to the pharmacy to get their medication supply. Yeah.
Khairil, unlike other groups that have been identified as groups that should not be or advise against taking the vaccine at this point in time, somebody who's living with HIV has probably encountered stigmatization or discrimination because of their HIV status. Do you think that being forced to declare your HIV status might become a problem for these individuals in the vaccination process?
I guess if it's not just for the vaccination as well, somehow or other we do still, see this stigma discrimination amongst the PL-HIV. But I guess comparatively, for the past, compared to, 30 years ago and now, I think it sort of has become less. But I think it's a responsibility for someone who's living with HIV to sort of, be upfront and be forward about their status. In terms of, let's say, in terms of in the medical aspect of it as well, at least there are some things that the doctors are aware of, things that they may want to pay more attention to in terms of their medication or any, interaction in terms of other medications as well. So, yeah, I think I would advise that, you should always be upfront and forward about your status.
All right. Well, Khairil, thank you so much for joining us on the show tonight and talking us through this issue. We really do appreciate your time and your insights. Thank you.
All right.
That's all we have for you on this episode of Consider This. And as Prof Ling mentioned a little bit earlier, guidances on COVID-19 and information about the vaccines change regularly, are periodically reviewed. So make sure you get the latest news and trusted information about COVID-19 and COVID-19 vaccines from Astro AWANI. You can get it on astroawani.com and the Astro AWANI app. Thank you so much for watching the show tonight. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Good night, folks. Thank you.